This is Dr. Boucher, hernia surgeon operating out of Lakeland, Florida. Perform around 400 hernia surgeries a year, ranging from simple to complex. Wanted to talk today about sort of a hot topic in the surgery community, and that's mesh use during your hernia surgery. Who needs it, and is it bad? So this is probably the most common question I get in clinic when discussing hernia surgery is patients asking, are you sure I need mesh for the repair of this hernia, and isn't mesh bad? I see a lot of bad commercials about lawsuits about it. And so, in general, the reason why surgeons use mesh for hernia surgery is to decrease the chance that your hernia comes back after it's fixed. And so, the reason is if we think your hernia is bigger than around 2 centimeters inside, so about like 1 inch from side to side, if you just suture that hole closed, the hernia hole closed with sutures and do no mesh, your chance of hernia recurrence or chance that the hernia comes back is relatively high. And as that hernia gets bigger, the chance of it coming back gets higher. And so the analogy I like to use is with laying a concrete foundation to a home where the mesh is sort of like the rebar and the concrete is your body's own scar tissue. Where if you don't use rebar or don't use mesh, initially everything looks fine. Like the next day after the surgery, the hernia will be gone. But over time, as you start to load stressors and vectors onto that area, your foundation will crumble over time if it's not reinforced. And so that's the reason for using mesh. And if I had a hernia, I would want it fixed with mesh without reservation. The other question, like, what is mesh made out of? It's essentially made out of polypropylene, which is the same material that like a plastic water bottle cap is made out of. And so, but it's thinned out into a sheet that looks like and feels like a screen enclosure. If you cut like a little circle of screen enclosure out, that's what it feels like. It's thin, it integrates super well into your body's own tissue. And the last part about mesh is make sure that you put it in the right spot. So like as your surgeon, it's our job to put that mesh in an appropriate spot where it's not at risk of coming into contact with your intestines. And that's where true issues where your intestines kind of growing into the mesh can come from. So there's lots of different planes in your abdominal wall to put the mesh in, but we try a number of techniques to keep that mesh from touching your intestines in a significant way. And so, to bring it all together, we use mesh because it decreases the chance that your hernia will come back. The chance of you having a mesh-related complication of significance is in the less than 0.1% chance or less. And if I had a hernia, I would want mesh used without a second thought.